Good afternoon to everybody, or kia ora to my New Zealand participants, or wherever you might be around the world. Thank you so much for joining me today in this short seminar on health anxiety. Before we get started, I thought I would just introduce myself so you know who I am and a little bit of background about me. My name is Ellen Kinsella. The spelling of my name is on the board there on the slide. And I'm one of Benestar's organisational development consultants, and I'm based in sunny Queensland, Australia. I have qualifications in both psychology and in social work, and I've been with Benestar for about 3 years almost now. And what I'm particularly interested in and passionate about is the preventative side of mental health. So some of the preventative measures that we can take with our approach to mental health and wellness. And it's my opinion that we can do this through raising awareness and developing your knowledge around the topic of mental health, around the variety of different topics that sit under that mental health and wellness umbrella. So with that in mind, I will introduce today's topic to you all, which is health anxiety. Now, today is a complimentary 30-minute session. And I'll just start to let you know that we do have a 1-hour version of today's topic available to our customers, which is slightly more detailed. And we do go into greater depth when we're talking about the health anxiety from a clinical perspective, along with a couple of other areas underneath the topic. So in order to condense today's session down to our 30-minute session, we're just going to do a high-level overview to give you a bit of an idea about some of the topics that we look at in our health anxiety seminar. There are no handouts for today's session, but if you do have questions for me, I would still very much encourage you to use our chat function box, and we will still be able to filter through them and get back to you over the coming days and weeks. So please feel free to use that function if you wish. We also have another complimentary session that's coming up on Friday, and that's going to be on unconscious bias and diversity. So what we can expect, or actually I will just also preface and say that before we do get started, Benestar is not a medical expert in the fields such as doctors and scientists and virologists. Our field of expertise more sits within the health and wellbeing space, so specifically mental health. And this seminar is not designed to be a substitute for any formal medical advice put forward by your doctor or your health authority. At the end of the session, I'm going to be providing you with some helpful and recommended resources for you all for both Australia and New Zealand. But if you do have any specific medical questions that you'd like to ask, perhaps referring these ones to your doctor if possible. If you're interested in reaching out also to Benestar with regards to our services, feel free to contact your customer relationship manager, or for any training or webinars that we have available, do feel free to contact us through the Performance Services team. We're available at performanceservices@benestar.com. Okay, let's get started. So first things first, we're going to be looking at our agenda for today. So these are some of the things that you can expect to take home from this 30-minute webinar. At the end of the webinar, we'd really like you to be able to understand the difference between what is health anxiety as a clinical diagnosis, and we're going to go through the things that are characteristic of this disorder, and that will really help you hopefully be able to distinguish between health anxiety as a disorder, but feelings of anxiousness and general anxiety with regards to your health, particularly given the current crisis that we're all facing with the coronavirus. So dot point 1, we're going to be looking at what is health anxiety, and number 2, we're going to be exploring normal levels of anxiety and common responses to health concerns. Thirdly, we're going to be looking at feelings of anxiousness, specifically looking at with the context of the coronavirus. Then we're going to be looking at how we manage these feelings of anxiousness regarding the coronavirus. We're also going to look at some helpful resources for you, as well as help from us. So help from Benestar as your EAP provider. So our first slide, what is health anxiety? Health anxiety is a form of anxiety. It's a legitimate disorder that's listed in the current DSM-5. And the DSM is the Diagnostic and Statistical Manual. It's essentially like a criteria check that mental health practitioners such as psychologists, and social workers and psychiatrists use to assist them when making diagnoses. So anxiety disorders in general, they differ from normal feelings of nervousness and anxiousness, and they involve excessive fear and or worry. Anxiety disorders, generally speaking, are the most common of all disorders, but with specific reference to health anxiety disorder, we're looking at about 4 to 5% of the population who present with this disorder. In the DSM, it's referred to interchangeably as illness anxiety disorder, or IAD. And prior to that, it was referred to as hypochondriasis or hypochondria. You may have heard the word hypochondriac, and this is where that originates from. In the extended version of this seminar, we do break down more specific criteria that people are required to meet in order to be given a diagnosis of health anxiety disorder or illness anxiety disorder. But for the purpose of today's short seminar, I'd really just like to highlight 2 key characteristics and share these with you. The first and probably most characteristic symptom of anxiety disorder or illness anxiety disorder is the disabling impact with which this heightened level of anxiety has on an individual. And we can see in that last dot point there, so it impacts one's ability to work and or study. So people are no longer able to engage in their academic commitments or their work commitments based on this, crippling anxiety that they're experiencing. They're unable to make and maintain their relationships with their friends and family, again, because of the anxiety that they feel specifically regarding their health. And generally speaking, they're not very capable of functioning the day-to-day activities that they once were able to do. So, for example, picking the kids up from school or maybe doing a grocery shop, things like that are very, very difficult tasks for people that live with anxiety disorder and health anxiety disorder. The other characteristics I just want to point out that are specific and unique to the health anxiety disorder is that symptoms need to be present for about 6 months consistently. Now, it's important to note that it doesn't have to be the same illness or the same disease that people have a concern about. So, for example, a brain tumour. A person doesn't need to be concerned about developing a brain tumour consistently for 6 months. It can be a variety of different concerns, physiological concerns that they have, but they do need to exhibit these really excessive these excessive worry around their health for 6 months. So it's important just to keep that in the back of our mind when we're maybe considering some of these signs and symptoms in the context of the coronavirus, because the coronavirus is still something that's quite novel and quite new. And finally, in order to make a diagnosis of illness anxiety disorder or health anxiety disorder, it needs to be, some conditions may need to be ruled out first. So if your symptoms are not better explained by another mental disorder, so for example, obsessive compulsive disorder, particularly we see people who present with compulsive and excessive hand washing or avoiding touching unclean surfaces. So if your behaviour and symptomology is better categorised by a different disorder, we need to rule that out first in order to make a diagnosis. So now that we've got a bit of an understanding about what, clinically speaking, illness anxiety disorder presents as, we want to have a look at how much worry is normal for everybody. And it's going to vary from person to person, of course. But the key thing we're going to be focusing on here is it's very normal for us all to be feeling anxious at any given time. It's it's a natural thing. It stops us from taking risks and doing silly things, and we tend to err on the side of caution as a result of feeling anxious. And your body is designed to send you signals when something isn't functioning quite the way it should. And we see this when we experience symptoms like fevers and sore throats and aches and pains and lumps and bumps. So your body is letting you know that your immune system has found something foreign and it's doing its best to recover. So while your body is sending you signs that it's unwell, it's very normal to feel concerned. So I just really want to normalize that experience for a moment for all of us. And this concern is generally what prompts us to go to the doctors or have some tests, or maybe learn ways in which we can manage or alter our lifestyle and behaviours to improve our health. So we're fortunate enough to live in a modern world where medical professionals and new research is more available to us than ever before. We're able to Google our symptoms at the click of a button, and a whole range of illnesses and disorders will pop up. And while it's incredibly helpful that we have this fantastic platform of being able to Google symptoms, it can sometimes be a bit of a hindrance to us, and it can certainly increase our sense of anxiety and our sense of worry, as opposed to visiting as opposed to visiting a doctor or a professional health practitioner. And our general awareness and practices around health and hygiene is now overall better. We have also got an ageing society. So given the fact that we have this ageing society, which is absolutely brilliant, people are living longer than ever. As a result of that, generally speaking, people are going to be more likely to develop some of the chronic illnesses that we see today. And of course, that's going to as well increase our level of anxiety and our worry, maybe for our loved ones. Our ability to travel is easier than ever, and we can certainly see this as both a blessing, of course, but in the context of our health and the spreading of different viruses, we've seen that absolutely very recently with the coronavirus, the idea that travel is one of the causes that's made this virus spread so vastly. It's important to note, though, the key difference with how much, keeping in mind all of these things in context. We've got our Google, we've got our aging population, our ability to travel, our research is better than ever before. Keeping in the context of all of these things that are available to us, it's very normal that we're going to be experiencing heightened levels of anxiety. But these levels of anxiety do not impact fundamental aspects of your life, generally speaking. So it's unlikely that these feelings of anxiousness are going to impact maybe your social life or your ability to work or study and your general day-to-day. So that's the key distinction I'd really like to make for you, is these feelings of anxiety and concern that we're all prone to experience is very, very normal. And it's a protective mechanism. And given the context of the world we live in, it's likely that you'll experience that. But the important distinction to make there is that it's not going to impact your social life or your study or your general functionality. So now that we have a bit of an understanding between the differences, I'd like to draw your attention to specifically feelings of anxiousness with regards to the current COVID-19 outbreak. As the situation relating to the coronavirus unfolds, we're seeing daily news reports, we're seeing travel restrictions and bans and concerns for your own health and well-being and that of your loved ones. It's likely that we're going to experience a wide range of thoughts and feelings and reactions. And that's what we're going to go through now, just so that we can really normalize that experience for everybody. It's perfectly normal to feel heightened levels of anxiety with this emerging health crisis, given that the mortality rate is rising, as well as the number of individuals who are infected. And also, so much of the virus is unknown in terms of how severe the problem really is, how soon we can expect a level of containment, lifting on bans, or the development of a vaccine. So much around this virus, because it is so new, is very unknown. And when things are unknown, it's likely that we start to question and start to panic and start to worry. Some of the things that we might experience with specific reference to the coronavirus, we have a couple of dot points here. So worry or anxiety, even panic. We've seen, particularly here in Australia, I'd be interested to hear how things are going in our neighbouring countries, but the panic with bulk buying of toilet paper has been quite an issue here in Australia, and it certainly spreads, and it's a social panic. You might experience some confusion. A lot of us are receiving mixed messages from different platforms and different individuals putting forward their opinion and their advice. Some of it can be quite conflicting, of course, which is going to arise in a certain level of confusion. You might experience anger or frustration or even helplessness. You might have a holiday booked. You might have travel plans that no longer are in sight for you, and it can feel quite frustrating. You can feel certainly helpless in this situation. And you might experience hypervigilance around health and hygiene, being concerned to touch door handles and surfaces. And of course, while it's important to exercise good hygiene, it's important to note that it's likely that some of you may be experiencing this heightened level of hypervigilance. And again, that's a very, very normal response. So now we have a bit of an idea of some of the signs and symptoms that some of us may be experiencing over the course of the coronavirus as it unfolds. I'd like to draw your attention now to some of the ways in which we can manage these feelings of anxiousness, specifically related to coronavirus. So the first thing, getting the facts from accurate sources. Try to stay up to date with the most current sources of information and from reputable sources. Try to stick to Australian government official websites or the World Health Organization as your source of information. Or for New Zealand, the Ministry of Health, I believe it's referred to. So trying to refer to the authorities when we're looking at New Zealand Ministry of Health, yes. When we're trying to get in and gather information regarding the health crisis. Trying to avoid salacious media, such as social media or secondhand information from people who, quite frankly, are not subject matter experts in this field. The second point there is avoid overexposure to media. If you know that you're noticing some of the signs and symptoms that we've just discussed, and you've noticed that you're becoming anxious, sometimes turning the television off can be the best thing for you. Or perhaps limiting the time that you spend on, social media, watching the news, listening to the radio, these things like that. Even just reducing your exposure can serve you quite well if you're somebody who is experiencing heightened levels of anxiety with regards to the coronavirus. Dot point 3, maintain a level of perspective. We know that there are certain groups of people who are more at risk with the virus than others, so keeping that in mind. And we also know that practicing good hygiene and following the instructions of our health officials is the best way to avoid becoming exposed to the virus. And it's important as well to acknowledge that while, of course, it's very, very serious and we're all acknowledging the rates of those infected and sadly those who have lost their lives due to the coronavirus, we do need to keep the perspective of people who have made a full recovery and who are likely to make a full recovery if they do develop the virus. Number 4, trusting in your experts. So avoiding treating media personalities such as morning TV show hosts and radio hosts and celebrities as sources of truth. We should feel confident in our scientists, in our doctors, in our medical professionals, that they're doing everything that they can, and we need to make sure that we're listening to the advice that they provide and any recommendations that they put forward. Number 6, practice good hygiene. Adopting healthy hygiene habits such as washing your hands with soap and water for at least 20 seconds. So some people say if you sing the happy birthday song twice, that's usually the right amount of time with regards to hand washing. But also, avoiding touching your face or nose or eyes if you have been in contact with unsanitized surfaces. Using hand sanitizer where possible if you don't have access to hot water and soap. Coughing into your elbow. These are all some of the good hygiene practices which we can all do to do our part. And of course, if you do develop cold and flu-like symptoms, seeking medical attention as soon as possible and avoiding public spaces where possible. Being courteous to your local doctor is another recommendation that we've received. So calling ahead and letting them know why you're coming in. They might have their own processes in place with regards to where you have travelled or any instances where you may have contracted the virus. So just cooperating where you can, being courteous where you can, and practicing good hygiene. Number 7, stay calm and stay healthy. So ensuring that you're managing your stress as best you can. We know that prolonged stress can have a huge impact on our physical and our psychological well-being. And one of the ways in which this can manifest is our immunity can become compromised. So it's in our best interests at this point in time to stay calm and really manage our stress. And we might do this through breathing exercises, through grounding, through health and fitness. There's whatever works for you, whatever you know is good for you. Utilize those tools that you have, and making sure you're getting enough sleep, making sure that you're getting the appropriate nutrition, maybe upping some of your vitamins, maybe making sure you're getting a bit of vitamin C and things that we know are helpful with boosting our immunity. 8, staying connected. Connecting with people around us improves our level of resilience. We know that relationships are actually the number one factor when we look at people's resilience. So maintaining levels of social connectedness is something we absolutely encourage. However, we are also trying to practice good social distancing and isolation during this time, but nothing stopping us from sending a text and making a phone call to our friends and loved ones to stay connected with them. It's very, very important that we do that. And the last dot point there is seeking additional support. So if you find yourself feeling overwhelmed by anxiety or concern with your health, seeking guidance, specifically if it's in regards to your mental health and well-being. Benestar can certainly help support you through that. We have our My Coach service for employees, and we have a very large and very skilled and qualified range of clinicians who can support you through that. We also have the My Coach for People Leaders service. So for those of you who are in people leading positions and positions of management who are struggling to maybe with large teams that you work with, if you need to maybe debrief or discuss any concerns that you have with a clinician, we offer that service as well. So that's My Coach for People Leaders. And of course, if there are any physiological concerns that you're experiencing, I'd strongly recommend seeking the guidance of your medical practitioner, so going to your GP. The next slide we're going to look at is some helpful resources for you. Now, for each of you who might be in different countries, these might look different. So I've just got a couple on the board here for you. So we've got the Australian Government Department of Health website. That's https www.health.gov.au. And then we've also got the New Zealand Ministry of Health, as I mentioned before, for our friends in New Zealand. And we also have the World Health Organization generally across the globe that we can all look to for helpful resources and advice as the coronavirus evolves. So just a quick slide with regards to Benestar. As I mentioned earlier, we do have our My Coach service that supports your entire work, health and life journey. It's important to note that it's not just work concerns. We can absolutely support you in all areas of your life and health and well-being. It's a confidential and non-judgmental service, and you can find us for face-to-face appointments, telephone, live chat, video, and online. We're available every day, and of course, it's a free service that is available to yourself and your eligible family members. And finally, where you can find us. So you can visit us on our website there in the middle, www.benestar.com. You can contact us on our call centre, 1300 360 364 for Australia, or for New Zealand, 0800 360 364. We also have a wonderful app called our Benny Hub app, and here you can find a tremendous amount of really great free and useful resources and tools with regards to health and well-being. We've got some guided meditations on there, so it's a very, very good source, a good resource for you all if you're looking to find some more information with regards to your health and well-being.